welcome to another edition of Am Abel Foundation's Medicine Makers, where if your destination is a career in medicine, we're going to lead you in the right direction. I'm your host today, Ishmael Mendoza, and I am joined by Dr. Nooshiq Salvador, who is in fact my mentor with the I Am Abel Foundation.
Yes.
I Am Abel Foundation is the pipeline for Chicago's youth and our next generation of healthcare heroes. So we are going to start our recruitment in the next couple months for our next class of mentees. If you're interested in a career in medicine and you are a high school, college, or post-bac student, visit www.iamable.org. So we're going to start off today's segment by welcoming Dr. Salvador, who is part of the Am Abel Foundation since its early development. Can you talk about your experience within the foundation?
Yeah, I'd love to. I remember meeting Dr. Conway at a hospital where we were both working at the same time. And I remember her talking about wanting to create this foundation, which she's done, and she's done a beautiful job in bringing physicians together and bringing medical professionals together and students, individuals who have goals and dreams and aspirations of becoming a physician. And it's been a beautiful experience having you as my mentee and having Diana as my mentee. I see how driven you all are, and you all are focused and committed, and it's just a beautiful thing to help individuals, the youth, in terms of fulfilling those goals and dreams.
Right.
So this has been a very blessing, much of a blessing, this experience, and I'm happy to be a part of the organization and to be your mentor. So.
Happy to be a part of it as well, and I'm looking forward to the years of guidance with you.
Yes. Yeah.
I'd like to just hurl into our topic for today, which I have personal interest in. In the field of medicine, there is the topic of traditional Chinese medicine.
Mm-hmm.
And I understand that you have completed a master's, and after your study in Western medicine, you decided to pursue traditional Chinese medicine. Can you talk a little bit about that journey?
Sure. So for me, it was a calling towards the study towards Western medicine. It was a calling for that, and it was equally a calling in traditional Chinese medicine. So that's the long and short of it. There are much details to that, but the general overview is that I felt a strong calling towards both, and I guess you could say in both there is a strong calling towards healing. What I've learned as a physician, which I find fascinating, is that there's so many ways towards the path of healing.
Right.
And as a physician, I have to be careful because I still believe that as a Western doc, this is what we do. We still are very intent on helping our patients through Western medicine, and yet we shouldn't ignore the modalities that are out there, not just in traditional Chinese medicine, but other modalities as well.
Right.
And so there are other studies, and there are trials, and there's just more information about things like how meditation helps us through anxiety, through insomnia, even through pain. So that there is meditation, and there's acupuncture. Which has its means of helping individuals as well. And so maybe, just maybe, as a Western doctor, if you have to treat your patient with, say, Tylenol or anti-inflammatories, or even for the chronic pain individual who's going through advanced stages of cancer, if they need opioids, to think about other modalities like meditation, like acupuncture, like food as medicine. To try and decrease inflammation in the body, and utilizing all these modalities, so just maybe you're able to decrease the dose of an opioid.
Right.
Maybe decrease the side effects of what we utilize in Western medicine. And so we're really getting more into understanding, utilizing these other modalities and how they can heal. And really that's the beauty that I find in it. And as I was saying earlier with you in our conversation, I'm just fascinated by the
Right.
different things that are out there that we can utilize in addition to the Western medicine we use.
For sure. You mentioned briefly acupuncture. For the viewers at home that are not familiar with acupuncture, can you briefly describe what acupuncture is and its effects and how it works?
Sure. Yeah. Acupuncture is a procedure utilized by inserting needles into the body. You can utilize them superficially by penetrating the skin. It can go deeper by hitting tissues like fascia or muscle. A trained acupuncturist would know areas to avoid and would know combinations of certain what we call acupoints to use certain acupoints in the body to help towards healing, and that could be to decrease pain, decrease shortness of breath, or treat anxiety, insomnia, headaches. So acupuncture is a procedure utilizing sterile needles and the insertion of these needles in these areas. We can probably show the audience the slide, yes, of the acupuncture needle, and so people have questions about, okay, when I know about needles, but it's about the syringes that
Right.
either blood draws or I needed a vaccine, and that you're not really hurt. With acupuncture needles, they're small, as you can see in this picture here. When it's inserted into the skin and then maybe even to the muscle and deeper areas, you're supposed to feel what's called deqi, 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 and it tends to be more of an ache. That's more of an achy sensation, not so much a sharp sensation, and that means that qi, the concept of qi, meaning life force or energy, has arrived to the area of the needle that has been inserted into that area of the body. So the needles are sterile. They're one-time use. They're very small, as you can see, and most individuals, after say a 10-15 minute session of the needles being inserted and left in for about 10-15 minutes, that kind of a session, usually people are very calm, feel very relaxed, and if they came in with a headache, they'll say the headache went from 8 to 2 or 7 to 4, and most individuals feel much better afterwards, which is also fulfilling as a person who's trying to help patients with their symptoms. So
For sure. I remember you mentioned your personal track record and experience with acupuncture in terms of just how many patients it shows success in. Can you mention that briefly?
Sure. So my studies were for achieving a master's degree in Oriental medicine. And part of that involved not just herbal medicine, but acupuncture. And in this school that I went to, we have to participate in clinics. So the clinics kind of run a little bit like what I remember in medical school and residency.
Okay.
It has that kind of similarity in terms of the teaching and learning aspects. And as a student, we had to go through multiple clinics. And so I believe I clocked in or logged in like over 500 patients. I think I logged in that amount. And in my experience, only 2 patients where it didn't help very much. And then, there were their own reasons for those 2 individuals, and there were much more problems in terms of dynamics, which probably inhibited their healing. But for the rest of them, I was fascinated by what I experienced myself as a person
Right.
of a physician of healing and watching individuals come in and feeling short of breath and walking away feeling wonderful. People coming in with back pain and headaches, and And I don't want to give the false information either that this is something that cures all. Just the same way, say taking acetaminophen or Tylenol, you have to kind of take it again if that pain is still there. At some point, the effects of the acupuncture do dissipate.
Okay.
And so it's important to know your body.
Right.
And be able to go back to that practitioner, the fully trained practitioner, so that they can address it again if it's something that returns. Because in no way should we mention about this being a cure-all for things. But again, it's a good adjunct in treating patients.
For sure.
Yeah.
In addition to acupuncture, the field of traditional Chinese medicine has a variety of other modalities, not necessarily popular in the US at this moment, but what are some other modalities in the field of traditional Chinese medicine?
Yeah. Here in the States, we can practice several things. So acupuncture is big in the United States. There's also Chinese herbology. So there are hundreds of herbs to study and to utilize that are safe when you go to a trained practitioner.
Right.
So the idea behind utilizing herbs and acupuncture, I think, again, this approach is another beautiful thing because placing the acupuncture needles in strategic areas in the body to work toward decreasing the pain or improving your inspiration or insomnia so that you can sleep better. The idea behind herbs in acupuncture is that they work together.
Okay.
It's maybe this herb is there with this taste, bitter or sour or sweet and has this temperature to it. There are temperatures to all different types of plants and herbs. And it will work with the 2 areas or the 3 areas that you use as an acupoint, and together they kind of work synergistically towards healing. And that's just a beautiful approach, using nature to try to heal. There are other modalities like cupping. So there's suction cupping where the cups that you use are more and they're not glass, but they tend to be more plastic or hard plastic. But you can't move them. There's also glass where you can use fire, and in that one you can do what's called moving cupping. Those are more for the types of pattern differentiations that we call wind cold or wind heat. Usually wind cold that they say is stuck and causing problems, or muscle pain where you can put cupping over that area to help balance as well. There's this modality of called moxibustion.
Right.
Moxibustion is we use an herb that's called mugwort, and in Chinese it's called aiye. And you burn this herb and place it over strategic acupoints, and it helps with building up yang qi if there's what's called yang qi deficiency. We've helped individuals, women who went through infertility, and we can use aiye for things like this. And there's e-stim, so electrical stimulation, where you place the e-stim over the tip of the acupuncture needle so that it kind of gives a little bit of a boost of energy to try to help with qi as well. I've seen individuals that I knew very well who went through overwork of a muscle because they ran a marathon.
Right.
Individuals who may have gone through, say, very, very small fractures in the outside of their foot where it just wouldn't heal, and it wasn't an overt fracture but a very tiny one because they did a marathon or something, and e-stim around that area really helped them heal, where they found that other things weren't helping them.
Right.
The ice and rest and massaging and toes above the nose and all those types of things that we try to do in Western medicine.
For sure.
And these modalities help these individuals so that they can get back to the things they love doing, running marathons and things like that. There's Tui Na, Tui Na is something that that's about, it's not just massage, it's massage over areas utilizing and knowing more about the channels that run through the body and the acupoints within those channels.
Interesting.
And utilizing Tui Na and certain techniques to massage. And again, try to restore chi and restore that yin-yang balance. And then there's Tai Chi and Qigong, which is more of a movement and meditation to try to, again, towards healing. And you can utilize any of these modalities together or separately, depending on your comfort level, depending on what you think might help you best. And if you're on medications and you have to avoid certain herbs, and that's understandable. There are some herbs that can interact with certain medications. So you have to go to someone who's trained in this, so that if you're taking blood thinners, certain types of blood thinners might react with certain herbs. And so these herbs are not benign. We think that because they're natural,
Right.
they're benign, and they can actually be quite powerful. So going to someone who's trained in this is the best way to move forward.
Going off on that, I want to leave our viewers with an idea of how to find that authenticity when seeking a physician that knows what they're doing, as well as for those interested in learning about the topic, where they can go to learn about this topic.
Right, yeah. My recommendation for patients is that, be proactive when it comes to searching for the individual, so that, there's to establish trust, because they are going to place needles into your body. And so that, finding that individual, making sure that they are certified. They have to have a license in acupuncture in order to be able to practice acupuncture. Here in the state of Illinois, you do require a license in order to practice in herbology in the state of Illinois. There is no license for that just yet. I'm not sure if that's going to change anytime soon, but it might. So I see we have a caller, but I do want to also say that that for students who are interested, also being proactive, there are several schools in the Chicagoland area. Those who felt a calling to, or feel a calling towards the traditional Chinese medicine aspect and don't want to pursue Western medicine, look into it and see the different locations, the various locations of these 3 schools in the Chicagoland area, and see what resonates with you, so that you can move forward and be a student and then an eventual healer in Chinese medicine.
Wonderful.
Yeah, I think I saw a caller. There we go.
Yes. Caller, are you on air?
Hi there. Thank you, Dr. Salvador and host Mendoza. I want to ask a question. I have really benefited from acupuncture in the past, but I noticed that for me, it didn't last as long as I had hoped that it would last. I mean, it got immediate relief, but it didn't last for me for a very long time. So I'm just wondering, is there a treatment schedule that is often recommended for different types of conditions, and what should we expect in terms of can we expect total healing over a period of time, or is it something that we would need to continue, repeatedly?
Yeah, that's a very good question. I'm glad that that question was asked, and every one of our bodies are different. We all have different makeup, different experiences, and so while the idea behind utilizing acupuncture is to balance that qi and restore qi and energy, our bodies are going to respond to that procedure differently. So I've had individuals where we insert the needles and they felt almost immediate effects. I've had individuals where we take out the needles and they are like, oh, I don't feel any different. And that has happened.
Right.
And basically the expectations is that we give at least about 8 treatments to see if there are any positive effects. And I've seen individuals where, again, if they may not sit in that immediate category, but for whatever reason that their body makeup is, the type of pain they have, the coming in with the type of history that they may have can also influence that, where we insert the needles and then after 2 or 3 times, there is this cumulative effect where we've had individuals after 8 sessions and they go, okay, I am starting to feel better. And so what we say is we can kind of hold off and give a break, maybe for a month, maybe for a couple months, maybe for 3 months, depending on how you're feeling. And if symptoms come back, then come back to us again. And then you might be that kind of person that lives in an area where you need it for 8 sessions or you need it for 12 sessions. And then there are individuals where they get a migraine and they go, I just need that 1 session and I'm good for several months. And so that's a very good question because I think if there's that, we need to know what our expectations are when it comes
Right.
to these things. Again, this is not a cure for things, but they certainly do help when it comes to treating symptoms. And everyone's body is different, and the response is going to be different.
For sure.
So, yeah, thank you for that call. Yeah.
I think I just want to leave our viewers with kind of a take-home message about what the future looks like of the merging between Western medicine and Eastern medicine and what they could expect for their patient care.
So are we talking more to physicians? Is the
Yes.
question more for physicians in terms of that? So, yeah, I've talked a lot with my colleagues who just kind of scratch their heads and go, "What are you doing?" and how does this fit into anything of what we do? And so if I was to answer that question for physicians to say, what is my expectation treating my patient, and then they're going off and seeing a traditional Chinese medicine provider, a practitioner, a specialist really, because if they've been trained the way they should be trained to be able to see patients, it will help as far as integrating all of these modalities, as many modalities as possible with little risk and great benefit. And so if there's little risk and great benefit, it's worth pursuing. And I see that there's another caller. There's another caller I saw.
We can take the question right now. Caller, are you on air?
Yes, I had a question. You wanted to find out, besides pain, acupuncture, I hear, is also good for emotions, like anxiety, people who are suffering from like PTSD and all that. And I just wanted to get your feedback on that.
That's a beautiful question. Thank you. I appreciate you asking that. We have taken care of individuals at the school where I graduated from. There was actually a clinic specifically for veterans who suffer from PTSD. Yes, you are absolutely correct. The approach in traditional Chinese medicine does utilize exploring emotions and sadness, worry.
Depression.
Yeah, worry, anger. Anger is a very strong emotion, and as all the other emotions, and they can really affect our quality of life. And in order to get to what the TCM, or traditional Chinese medicine, pattern differentiation, which tells us how to move forward with particular modalities, using those emotions help us and say, our patient is fitting in this particular pattern differentiation. This is how we're going to treat this through either acupuncture, massage, herbs, moxibustion. So the person-centered approach in traditional Chinese medicine does utilize exploring emotions. And that is a very, very strong, integral part of practicing TCM. And this is what I love. Again, I'm fascinated by this as a Western doc, having studied this, seeing that patients do feel better. And just like the first caller asked about how long that would last, everyone's body's different. But at least going through those 8 sessions or 12 sessions, depending on how you and your practitioner are comfortable with moving forward with that and seeing how you're doing and reassessing after those sessions. So I hope that answers your question, caller.
It did. Thank you so much.
Thank you for the question. And that about concludes our edition today on traditional Chinese medicine in the Medicine Makers. Thank you for joining today, and have a nice night.